Okay, welcome to my review of the Healthcare Voice Assistant Consumer Adoption Report for January 2022. I'm Brett Kinsella, host of the VoiceBot podcast, as you know. So, if we look at this, voice assistant use in healthcare by consumers has nearly tripled over the past 2 years. This is an important trend. It complements another trend in medical providers also increasing adoption of voice and conversational AI technologies. Both segments, consumer and the provider side, saw significant surges in use driven by the COVID-19 pandemic, and they both continue to today. So, what we should do is first discuss the top line numbers for consumers because I think they set the stage for giving you a sense of what's actually going on right now. So, in 2019, we found that there were 19.1 million US adults that had used a voice assistant for some healthcare related service. Could be any of the different services. In 2020, that jumped up to 51 million. So we went from 19.1 million in 2019 to 51.3 million in 2020. What happened in the intervening time period? Well, this 2020 number was taken in August, September timeframe of that year. Obviously, we were in the midst of the pandemic. It had been going on for several months. A lot of people had started for the first time using voice assistants. Now, those might have been general purpose voice assistants like Alexa, Google Assistant, Siri, for example. They might also have been assistants provided by healthcare providers, although there were very few of those at that point. So it was mostly these general purpose assistants, and then a few that were being offered, which would be considered custom assistants or owned assistants. But just think about that from 19 million, about 20 million, up to 51.3 million. That was 7.5% of the US adult population to 20%. Now, this continued into 2021. And so this is where we get the near tripling. So we got 21% now of the US adult population for 2021. And that was towards the end of the year. So 54.4 million people. So it did inch up a little bit, but most of that growth happened between 2019 and 2020. And then we had, something like 8% growth between 2020 and 2021. Okay. So that gives you the sense that there are over 50 million people that have used some sort of voice assistant for a healthcare related service. And that's a significant difference than 2 years ago. So I think the key takeaway here is really just COVID-19 changed everything. Okay. But this is really just part of the equation. So, consumer use and interest in voice assistants for healthcare, it also looks at not just who's used it, but who has the intent of using it if it's available. So, one of the things that we said is 7.5% had used it in 2019, 21% had used it in 2021. But let's talk about interest. So, just about 52% of US adults said they were interested in using some specific use case associated with a voice assistant. So they would use voice to ask for, and we'll talk about the use cases in a few minutes. Could be anything from diagnostics to scheduling an appointment to asking about medications. There were a lot of them that we asked about. So just over 50%, 52% of people were interested in 2019. That moved up to 56% in 2021. So again, a small rise, about 10%, went up in terms of interest. At the same time, usage almost tripled. So there's a specific phenomenon here that we think about, and it's really something that we consider a supply gap. So if you have 7.5% of consumers that have used something, but 52% want to use it, it's because they're supply constrained. It's the healthcare providers aren't providing voice assistants. The general purpose consumer assistants aren't providing the type of services that people want. And even when you increase this, because there was such a disparity in 2019, we tripled, but we're still less than half of the people who want to use a voice system for some healthcare related service have done so. Okay, so this is a supply gap. And we're starting to see the healthcare industry close that, but the supply gap definitely remains. And so that's really important. But let's talk about what that gap is about and what consumers really want. So there's a few different use cases that we asked specifically about And the one that's the most popular, obviously, is asking about illness symptoms. So you think about this idea that you have a problem or a family member has a problem. How do you get that? You go online, people are typing, tapping on their phone. So much easier just to ask because we're talking about this complex input situation. Voice is really good at complex inputs and simple outputs. We've seen that time and time again across industries, across other types of applications. When you're talking about illness symptoms, there's a lot of different things you have to say, and there's many different ways that people might say them. This is really a perfect application for a smart and a natural language processing system that can actually line this up with what you're trying to do, can come back to you maybe with clarifying questions to, as we would say, slot fill, but really just fill in the gaps in the information as it tries to do a diagnosis. So we have this idea of illness symptoms, and we've got some other ones too that were really popular here. So finding a hospital, clinic, or urgent care, that's the second one in terms of consumer interest. Asking about medication information is third, and finding a doctor or other healthcare provider. Okay, so what we just did, the top four there, those fall, there's two ask and there's two find type categories. So you're asking about illness symptoms, you're asking about medications, you're trying to find a doctor, you're trying to find a facility like a hospital. So think about this. These are search functions. Patients want to use voice assistants to help them search for healthcare information. It's really not that surprising. We do that already today online, but we're trying to think about this way that we can use this new technology to make it even more powerful. The fifth use case, by the way, is scheduling a doctor or hospital visit. So this is a task feature, and it's one that is a logical follow-on to the search because you find what you need and then you want to schedule it. So maybe a little bit more on this in a couple of minutes. I want to move on though to say, okay, we have this idea of some of the use cases people care about. We know a lot of people want to do this, but what do the demographics look like? Well, men and women equally use voice assistants or equally have used voice assistants for healthcare so far. And I thought that was an interesting finding. There are some other things that you can look at where you can see that women are actually heavier users of it. But in terms of just nominally who's tried it, men and women about equally have tried it. And then women, when they do use it, tend to use more use cases than men do. So they're heavier users. So that's one thing that I thought was really interesting from a demographic situation. The other thing that I think you'll find interesting, I found it interesting, and it's consistent over the last couple of years, is the use of voice assistants in healthcare is actually higher in lower income households. So lower income households have higher trial rates of voice assistants in healthcare. And that trend actually continues to fall. So think about this. So as household income increases, fewer and fewer households have tried voice assistants for healthcare up until about $200,000 in household income, and then it bumps back up again. But still, the highest is the under 50,000 household income. And so what does that mean? So what we surmise is this reflects a situation where lower income households often face higher barriers to accessing quality healthcare. And voice assistants may help overcome some of those obstacles, particularly if healthcare providers offer robust solutions. So we have this situation where maybe lower income households don't feel like they have as much access. Maybe they're more time pressed. There's a lot of different types of things that could happen, but they are so far asking voice assistants more for healthcare services. And this is a really clear message to healthcare providers that if you're intent on serving lower income families, that this is a great way to do it. And to think about the benefit here that you actually can use natural language to interact as opposed to like complex search terms and trying to figure out how to find the right information. Just allow people in natural language to ask what they want and deliver them the information. That's really a great public service from a healthcare provisioning standpoint. It's also really important for people who are worried about equal access. And so I suspect that over the next couple of years, this should be a higher priority item for healthcare to consider, that this is something that they should be doing just because it's the right thing to do. Plus, you can actually see that there's a significant benefit from an access standpoint. Okay, so let's talk about COVID for just a second. So we mentioned COVID at the top. We saw the intervening time period when COVID came about, and that there were more and more people who were using voice assistants for healthcare. We also have some data on this. So the pandemic health impact in healthcare for voice assistant interest. So if you look at this, about 46% of patients were much more likely, or somewhat more likely, so more likely to use a voice assistant or to have interest in using a voice assistant for healthcare since the pandemic started. And it's really de minimis. It's less than 10% are less likely. So there's about 40%, the plurality, say they're neither more nor less likely. But we see about 46%, a little bit more than that, actually are more likely to use it. So it has made a really big difference. Okay, so let's step back here and let's consider the entire market. When we think about how it's developing, VoiceBot breaks down voice and conversational AI technologies for healthcare into two broad categories: patient services and clinical services. So in patient services, we've just discussed a number of these patient services. You can categorize them as medical information sharing, patient logistics and support, at-home patient care, and in-facility patient care. And we outline all of this in the Healthcare Voice Assistant Consumer Adoption Report, which we were just talking about. So let's talk about a couple of these different items in terms of patient services and some of the players that are involved. So we talk about Orbita, which is helping hospitals and healthcare providers communicate more effectively, both with patients, but also with staff, but mostly with patients. We talk about Mayo Clinic, which has been providing a significant amount of medical data. So that number one use case was finding out illness symptoms and trying to go through a self-diagnosis. Mayo Clinic is providing some of the most robust data sets out there for people just on the web. They are the default for Amazon Alexa. So that's one of the important ones. And then there's some of these other solutions: LifePod, LEQ, Amazon Alexa Together, which is a new program which was announced last fall. These are all based on this idea of helping care for people who are at home, who are either older and have health issues, or could just have lifelong chronic health issues, and providing them with services that are generally some sort of device, could be a smart speaker in this case, or something similar. And it's giving them recommendations or reminders around medications, might be asking them for how they're feeling, might connect them with their loved ones or their caregivers, who then can check in on what they're doing and see if they've done certain things throughout the day to make sure that they're taking care of themselves, or just to do a drop-in so they can do a quick video chat and see how they're doing, or just make that connection. Stanley Healthcare also has a solution here that they license from Priya. I think it's they license from Pillow. It's called Priya. And then you have some organizations that are doing this at the I don't want to say institutional level, the community level. So the elder communities, nursing homes. There's a lot of different terms for these types of things, but this idea that you can provide higher levels of service, and this is true also if you have in-home care that's coming, by providing a device there or at a managed facility, you can provide the patients with better services. They can do more things for themselves. They don't have to always ask for things. You can use it as an intercom. There's a lot of real big benefits here. K4 Connect is one of the companies that's invested heavily in that. Okay, so let's talk about clinical services. So with clinical services, we have, again, 4 subcategories. So we've got the clinical use for data capture, which is one that a lot of people know about now because of a lot of activity in the market. We have clinical use for patient data collection, clinical use for diagnostic assistance, and clinical use for direct diagnosis, which has been one of the more interesting things that's happened over the last year. And if we bring our image back up, we will see that we have a lot of startups and some big companies in this space. So first of all, this idea of clinical use for data capture, the number one story in voice AI in 2022, 2021 was Microsoft's acquisition of Nuance. Almost a $20 billion acquisition. It just closed not too long ago. Microsoft, interestingly enough, in their announcement, really just focused on the healthcare angle. Now, Nuance over several years had actually divested a lot of its business lines. And after the spin out of Cerence in the fall of 2019, which was the automotive business, the Nuance Automotive became Cerence as a separately traded public company. Mostly what you had left was Nuance Healthcare and then Nuance's contact center business. And the contact center business is big, not as large or as dynamic as the healthcare business, but actually very large. Nuance was a pioneer in the IVR world. That's interactive voice response. Those are the systems you interact with on the phone. And so that was already large, but Microsoft didn't really talk about that much. They kept talking about the application for healthcare because Microsoft really wanted to get into healthcare in a more meaningful way. And Nuance, particularly for this clinical data capture, is the big dog. And it's the Nuance Dragon Assistant. It is something that reduces the amount of time to enter data. Almost everybody's probably experienced this. You go in to see a physician, a care provider, and they spend all the time typing and looking at the computer, not actually making eye contact with you. You'll see some of the better staff physicians' offices might have a physician's assistant who's doing the typing so the physician could focus on you. But what this is all about is they need to get that information into the electronic medical record. And it is tedious, but it's also very important. And what Nuance and a number of other companies in the space have looked at is say, we need to make sure that these highly trained professionals, medical doctors, physician assistants, are actually paying attention to the patient and not really just glorified data entry clerks. And so, Nuance's Dragon system is Dragon Personal Assistant. It will actually hear the medical jargon, will automatically enter the data into the right fields. They're integrated with a lot of the large electronic health records software providers. And so it really streamlines that process. They have a lot of other benefits they talk about, but really it's about streamlining that process and hopefully enabling the care providers to spend more time actually caring for the patients. Now, a lot of other companies noticed that this was a big business. So Notable is another company in the space. They're a startup. They raised $100 million this past year based on some of their work in this space around physicians' notebooks and automating that process of capture. Suki, which has been on the VoiceBot podcast, the founder, and they came out several years ago with a $20 million round. They just raised another $55 million just a couple of months ago as well. Seikara, another company that was started by one of the engineering vice presidents from Nuance who left to found his own company. They were actually acquired by Nuance last February. So that was another company that, Nuance already had a system, but they wanted to bring some of these additional capabilities that Seikara was developing back in house. And so there's a lot of activity in this place. So keep looking for that clinical use of data capture. It is becoming standard. I expect to see it everywhere so that we don't have to see this data entry clerk issue with the physician providers, but also I'm expecting it to be higher accuracy over time. And also as the systems become more intelligent, they can then listen to what's going on and offer assistance to the care provider. because they might hear something, they might do some matching, they might have some access to some recent medical literature from the journals that could give the care provider some additional information about how to properly diagnose or treat a particular patient issue. So I think that's a really important concept, and that is this idea of clinical use for diagnostic assistance. And many people remember that IBM was one of the first to come out with this, with Watson. It was really focused on this idea of pulling additional medical data on to provide this assistance to the care providers in their diagnoses. And I expect to see more of that. We saw another tool come up last year from Bayer called AMI, AMI. And that was for medical information specifically around medications. And they had 5 medications that they would give additional information on to the physician. And they were planning on adding more. We're going to see a lot more of these. Beyond this, and even Nuance, I expect them to have more access to these large data stores at some point. And maybe Microsoft will take them in that direction. But physicians are also using that today now to pull up medical data from their patients. And so there's this diagnostic assistance and using voice, really a powerful tool. Then we also have this idea of clinical use for patient data collection. And one of the better known companies in the space has been doing this for a long time is Sensely. I think they're over 20 years now, or maybe just nearly 20 years now. What they found was that when you are post procedure, post visit, if you have this long-term care or follow-up, that there's this obstacle of getting the patients to provide the information in a way that the healthcare providers can utilize that in a timely fashion. And so it's this idea of a virtual notebook that they're recording how they're doing each day. And that can be really helpful from a care provider standpoint or the physician figuring out how they're doing in terms of in terms of their care. Essentially found that if you could certainly, people could type this in, but they had lower compliance rate than if they allowed people to speak. They did some other things with avatars, which were very interesting as well. But again, it's just really streamlining this idea of getting some data from the patient into essentially the medical record in this case. And at a time when it doesn't require a doctor's visit. So Boston Children's Hospital also experimented with this a couple of years ago using just an Amazon Alexa device. And this, again, was another way for post-procedure for parents in this case to enter data or to speak data into the record about how their child is doing. And this was designed to not only capture the data so they could be used for follow-up, but also to alert healthcare providers if they noticed there was something that might be going badly for the child's recovery. So I believe that this is going to be, again, a standard of care coming up in the near future. There's a number of companies who are going to be participating in this, but it seems like the best type of application for healthcare, where you're allowing the patient to provide more information, to do it in a more convenient way, and it gives the physician then that information that happened 2 weeks ago that the patient might have forgotten by then, but they have access to it right there. It allows the systems to start to do matching in the background about things that are said and over what period of time. So this is going to be, I think, a really significant benefit for healthcare if people will implement it. So healthcare providers have been very slow to implement it. I do believe that they probably recognize that it would be helpful, but they haven't made it a priority. And I think this is often the situation where you treat the patient in front of them, and this is very natural for humans to do. But once the patient is left, then what, right? So they're not present. Should we assume they're okay? Now, there's been this real focus over the last decade on healthcare outcomes and particularly post-treatment. And that's come down from national government edicts, but also just from a care practice standpoint. I expect to see a lot more of this. It's not going to come fast enough because I just don't see them creating enough priority around it. But maybe in this post-COVID world, people will focus on it a little bit more. So, as you can probably tell, I'm pretty bullish on this. So, the other thing that really significantly changed because of COVID in the use of voice technology was to use it for clinical diagnosis. And one of the highest profile activities in this space has been Vocalis Health. They actually had a more than 80% accuracy rate for just having people basically speak 20 numbers into a mobile app. With 80% accuracy, they could tell if they were positive for COVID or not. This is actually a higher rate of accuracy than most of the tests out there. So this was on the heels of something they'd already done around predicting heart failure for a hospital, just based on calls from patients to their care providers. They were able to predict with a very high accuracy how many of those patients would actually suffer a heart failure incident in the 3 months after that call. And so they use that same type of technology around vocal biomarkers to apply it to COVID, and really it's been tremendous. They've rolled that out. They had a big rollout in India. They've done some things in Israel along these lines. Aside from Vocalis and what they've done in these two different areas, I think it's really important that what this has done is this is just going to build confidence in the medical community around how you can use these technologies for diagnosis. Another example is IBM and Pfizer teamed up to use what's called a verbal test for Alzheimer's, which is a standard test, and to see if they could do a match of the likelihood of having Alzheimer's or not. And what they found is they were actually 70% accurate using the voice interactive system and the diagnosis. And 70% is pretty good, right? So you want it to be much higher. But you have to understand it compares to 59% for clinical predictions. So actually, the system that IBM and Pfizer created for diagnosis for Alzheimer's was more accurate than what a clinician who deals with this all the time was actually delivering. So that's really significant. So it's another one of those examples where we can use the technology to help the healthcare providers either be more efficient or maybe be more accurate, maybe identify things that they might not have otherwise, and provide, potentially more control and agency for patients to take care of their own healthcare. So I think those are all pretty amazing things that I've been pretty excited about over the past year. And let's see. So I think this brings us to the end. Those are some of the key points that I wanted to tell you about what came out in that. Obviously, there's a lot more in there. Let me tell you what I think the big summary here is. So COVID was clearly a catalyst for change. Conversational and voice AI technologies obviously had a huge surge in adoption. What we found from the enterprise side, so the healthcare providers, projects that they had maybe done a couple of proofs of concepts or pilots and just basically stagnated, things that they had talked to vendors about for years, all of a sudden were funded in a week. That's what 2020 was like in the spring. It was amazing because they were facing so many problems. They needed to automate some of the aspects of how they communicate with patients because they just didn't have the capacity to do that. They had other issues as well. I tell people about this story that Joe Petro from Nuance shared with me a little over a year ago. We were talking about what happened for one of these healthcare systems in the Northeast. In February of 2020, that entire health system did 1,500 telehealth visits. In April, they did over 200,000. So we're talking about order of magnitude increase. But think about what that means. So you think, oh, okay, well, is that a big deal? Well, you have to schedule it. You have to have people call in. They don't know how to use the technology. So how do you provide that information to them? these voice interactive technologies, whether they're chatbots or voice assistants, are great ways to field some of those really common questions. So you're not overloading your switchboard with people calling in to really find out some of this basic information just because they've never done telehealth before and they need some basic details that might go beyond what you can provide on a web page. So I think that's really important. COVID was a catalyst for change. That's one of the takeaways. The second, adoption was really broad and rapid. So we went from fewer than 20 million US adults that had tried voice assistants for healthcare up to over 50 million. We see it basically gender balance. We see all income categories using it and increasing the use, but we particularly saw the higher level of use in the lower income households with less than 50,000 annual income in the household. So really important. And the other thing I will say is you should temper your enthusiasm a little bit because adoption has tapered. So we saw that it went up to just over 50 million, and then just grew, instead of going 3x again, it just grew, less than 10%. So I believe that the adoption of these technologies will now move at a more deliberate pace. It is not for lack of consumer or patient interest. They want to do it. They have more interest in this than there is a supply of solutions from healthcare providers. So this is completely on the healthcare providers. They are going to be more deliberate because that's what they do in healthcare. They take their time, and a lot of the urgency seems to have subsided. So I do believe that we're more likely to see these things. So the certainty of them coming forward seems to be much higher. But at the same time, I still think we're going to start to see some of these projects delayed a little bit more. And the last thing I'll just bring up. So the clinical use of voice assistants is now common, and it's going to expand. Again, I think this will be a deliberate pace, but healthcare systems have tried this. There's a lot of proof points out there. We see more and more strain on the healthcare systems time and again. And healthcare systems now know that they have to be prepared for these surges. And it's really a responsibility of theirs, not just to have just matching capacity and nothing more. They're going to have the ability to surge capacity, and AI and voice assistants are a great way to do that. Okay, so that's it for today. I'm Brett Kinsella, founder of VoiceBot Research and VoiceBot.ai. I'm also the host of VoiceBot Podcasts. If you'd like to review the data in more detail, you can find the full report at research.voicebot.ai, research.voicebot.ai. In addition to the data presented here, we have more demographic details. We have patient perceptions of chatbots, even patient interest in use of IVR systems and how they think about those and how they relate those to voice assistants and which ones they think are better. And there's a whole lot more in there. So over 30 pages of analysis, 22 charts. If you're in the healthcare industry, I think you'll find it very valuable. Also, if you have any thoughts or questions on what I talked about today or what you see in the report, hit me up on Twitter @Brett Kinsella. Until next week, bye-bye, everyone.